Thanks for staying with us. Now, visitors will now be able to enter the country with vaccine certificates that have a QR code. Officials will still verify that the information matches the passport holder's details. It follows hundreds of travellers, possibly thousands, stranded at OR Tambo International Airport. The problem was with the absence of a global vaccine certificate template. On-site testing will still be available at ports of entry. Let's get more details from the acting Health DDG, Ramphelane Morewane. Thank you so much for your time, sir. We do appreciate it. I think let's just get a response from the Department of Health with regards to why Port Health was not properly prepared to make sure that those coming from outside, their vaccine certificates, whether it was a card or or virtual, was actually accepted, and if there was and there should have been possibly a proper standard or template that was acceptable.
Good afternoon, and good afternoon to the viewers at home. Thanks very much for having us to explain this situation. I don't think it's a matter of people not having been unprepared. As the statement that was issued stated, our regulations had been written in such a way that we're saying people must be in possession of a vaccination certificate. Now, at the time of writing these regulations, we knew what we meant, right? But when suddenly it came that in some countries, people are using cards, when in our interpretation, vaccination card is that card that you get immediately after being vaccinated on site. So officials were merely using what the law was saying. It's not a question of being unprepared. And I'm saying not unprepared. It's not a question of being unprepared, because as soon as that matter was cleared, the lines were cleared. I was at the port of entry that the evening following that incident. Around 7 o'clock, there was no queue, there was nothing. In fact, when I was there, 2 or 3 airlines landed, and they cleared the lines. I mean, within a matter of minutes, people were processed through, because we had made it very clear. So it was not a question of either lack of capacity, lack of preparation. It was purely them implementing what was written in the law.
So I disagree, because we've had passengers contact us. I've had my phone ring non-stop with regards to passengers saying that they have been standing in queues for hours on end because Port Health are not accepting their vaccine cards, because the vaccine card doesn't say vaccine certificates. So there seems to have been some discrepancy with regards to the word vaccine card, and Port Health was only accepting vaccine certificates. So as much as you say that it wasn't an issue of not being prepared, this is not what passengers were subjected to. And given the uncertainty and all the documentation that's needed when it comes to COVID-19 and how difficult it's been to travel because of COVID-19 and everything that's needed to travel, I just want to know why perhaps other countries and other governments were not perhaps reached out to and discussed with regards to what is acceptable and what kind of vaccine certificates they are bringing into the country, so that Port Health is aware of this and there's no pandemonium at the airports.
Yeah, look, I don't think me and you are in disagreement. We are not in disagreement. What we did was, as I'm saying, I mean, it's what is in the law. But as soon as that was cleared, it was no problem. Now, when you travel to a country, you get subjected to the conditions of that country at times. You travel to a country, in our country would say to you, for an example, we don't need to do exit screening. We think the exit screening is a responsibility of a country of destination. But you get into that country, you come from South Africa, when you want to come out, they say to you, no, but you must still do a test. Then you can't demonstrate with them and say, look, but in my country, we don't do this. You can simply seek to make them understand or comply. Now, what happened was, when it was clear that what people refer to as cards, we referred to certificates with the QR code. Once that was clear, as I'm saying, it was a matter of minutes that people were processed through. And sitting here 2 days later, we can't even argue that this will repeat itself because we have cleared it. So we are confident that now there's a clarity of understanding as the statement was issued by government on what happened, expressing exactly what happened and how the situation must be managed in future. So from where we're sitting, it shouldn't be a problem. But I do agree that when people are frustrated, having been in the plane for over 10 hours, or even if it's 2 hours, people may feel extremely unhappy when they are made to queue stand in the queue. Now, when you said in the opening statement, you said hundreds or most probably thousands. Supposing we are right that it's 1,000, I don't think your phone rang 1,000 times, but I'm sure many people called. And I'm not saying they didn't call. I'm just saying people called. And I'm saying to you now, we're sitting at a point where we're saying, one, any form of verifiable proof of vaccination with QR code, with the details that are missing, those details that are in the passport, those kind of evidence are available, are acceptable at a port of entry, at a time of entry.
So even if my phone rang once, I mean, that panic at the airport was, quite frankly, unacceptable. I've completely run out of time, but I just have to ask you one last thing. Are we 100% certain that Port Health understands the process, that it's the QR code that they need to assess and make sure it matches the details of the passengers' passports, and there will not be pandemonium at the airport where passengers are not being allowed to let through because of a simple word of vaccine card and not vaccine certificates? I think we've unfortunately lost him, but he did indicate that it seems as though all has been sorted. I do hope so.
Here.
Oh, he is still here. Okay, if you could just answer the question, answer the question for us, please. We're running out of time, but maybe just tell us that you can assure us that everything has been sorted out.
I can assure you that, in fact, the main contributors in the writing of this regulation is colleagues that are experts in Port Health, the actual Port Health practitioners. So they understand the rule. Now that we have cleared it, there's no confusion. There should not be any confusion, and everything should run smoothly.
Okay, great. We'll keep you to it. I'll definitely be checking in and seeing if all of that is sorted out. That was Ramphelane Morewane, who's the acting Deputy Director General for Health here in the country.